Hey everyone, welcome to this edition of Clinical Corner, where we're going to be talking about the principles of nursing documentation. So, Betsy, what are the challenges and the significance of documentation?
So documentation is something that we learned from day one. So it's very basic. However, when you start practicing, it's really tough to keep up with documentation. We're busy. We're giving patient care. So sometimes documentation can kind of fall by the wayside. But what we need to remember is we could get in a situation where the only thing that's protecting our practice and our license is what we documented. So it's something that we need to take seriously and really remember how important it is.
And why is documentation so important?
Well, documentation obviously is to document. So if we ever need to go back and look at a situation and kind of piece together what happened, we need to have that documentation there, and it needs to be accurate. Also, there's financial implications for documentation. If you don't chart something, then you can't get reimbursed for it. So that's an issue. Also, a lot of providers nowadays are checking in on their patient from remote areas. So if the charting isn't caught up to date as much as possible, they're not really getting an accurate picture of the status of the patient.
Yeah. And what should nurses consider when charting?
So I hear from a lot of nurses and a lot of stories of missing documentation, unfortunately. One of the more common ones is contacting a physician and what came out of that. I've had people say, I paged the doctor 4 times in a span of 2 hours and he never returned my pages. Well, if you don't chart that, then it looks like you didn't do anything for that patient, and that's on you. Also, any rationale for deviation from orders. So if you have a patient who refuses a treatment, or if you hold a medication because of a lab value or something like that, you need to write down why you didn't follow those orders to, again, cover yourself.
Yeah. And what other tips and tricks do you have for charting?
Yeah, I think nurses are really good on figuring out their own system for charting and remembering what to chart when you finally get a chance to do it. When I was on the floor, I had my own set of brains where I had a sheet on every patient. And then if I got into a difficult situation, like a code situation or something, I was able to just jot down like times when medications were given and things like that. So then when I could go back and chart, I had all that information right there.
And it seems like you were always on the go, like all nurses are. What if you forgot to chart?
Yeah, and that happens, unfortunately. They do say that you have 24 hours in which you can back chart. And you can back chart later than that, but then it kind of starts to get questioned. So ideally, you want to finish all your charting before you leave. And if that's not possible, try to get it in that 24-hour window.
Well, thanks for all that great insight on documentation, Betsy, and thanks for everyone tuning in. If you have any comments or questions on the documentation topic, you can contact your RRIS recruiter or comment below in the comment section, and we would love to chat with you. Thanks for tuning in.